How many times and how often do I have to go to the chiropractor? What if I just hurt for a week or so? Do I have to go to the chiropractor forever? Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I want to speak to you about a topic I deal with just about every single day. So many people have heard that you got to go to the chiropractor a million times, so they never take that step to address pain when it pops up. Then it turns chronic, long-lasting, and it becomes harder to treat. It just doesn't have to be that way. So make sure that you share this video with your friends and family. It'll hit home with some of them, and if they start having difficulties down the road, well, they'll remember what I said right here in this video. I don't want to spoil the whole discussion, the whole video here from the very start, but the answer is that typically you don't need to go to the chiropractor a lot. Plain and simple. But stick with me, and I'll discuss why I say such a thing. Myths and misconceptions, okay? There are some misconceptions or myths about chiropractors or the profession in general. A couple of the biggest ones of them are that chiropractors want to see you a ton of times. The other one is that once you go to a chiropractor, you always have to go to the chiropractor. So let's address this. Let's start with the one, chiropractors want to see you a ton of times. Now, I think the answer to how many times a chiropractor wants to see you mostly comes down to three things: experience, education, and the style of practice. So let's start with experience. The longer a chiropractor has been in practice, the more experience they gain, obviously. And this allows the provider to better understand which patients will do well with minimal work and which are going to take a little more attention. All things considered, I'm not sure anything in a provider's toolbox trumps just good old-fashioned experience. It can't be bought and it can't be traded, only lived. To simplify the thought process, the less time pain has been around, the easier it is to treat. The longer it's been around, the more difficult it is to get rid of. And most patients can make sense of this idea fairly easily. It just makes sense. Now, next on my list is education. Unlike experience, you most certainly can buy education, right? Some providers, unfortunately, they just get out of school and they feel like they've learned it all, and that's all they're going to learn. They're simply unmotivated to further their education, so they kind of fall into patterns that they learned in school. Patterns that were, in many cases, learned 15 or 30 years ago. Now, this is concerning because research guidelines and procedures change when new research comes out, with new emerging research. And as the changing knowledge evolves, these things change. They don't stay the same. So just think about the medical field, for example. They used to perform what I call the big L's. That stands for lobotomies, leeches, and leading, as in bloodletting. Now, thanks to research, science, and a willingness to follow the research in science, there are things available to us now like heart transplants, incredibly functional prosthetics, and immunotherapy for cancer patients, just to name a few. And not to mention the mRNA vaccine that just came on board during the COVID pandemic. That was a medical wonder. In much the same way, other professions, chiropractic included, should continually update their guidelines and treatment as research continues to shed a light on the path going forward. Once upon a time, chiropractors would guide patients into treatment that looked like 3 times a week for 6 to 8 weeks, followed by 2 times a week for 6 to 8 weeks, then 1 time a week for 6 to 8 weeks. And before you know it, the patient has gone to the chiropractor for around 50 to 70 or more visits at a cost of $2,000 to $5,000. I recently had a patient in my office that went to the chiropractor every other week for years and years, and she came to me in significant pain. If going with that frequency were effective, well, they would have never needed to come to a different clinic. It would have worked years ago. Now, with stabilizing and exercise, well, she's feeling a lot better for the first time in a while. And the future is looking bright. And she's just one of the best people on the planet, by the way. She deserves good things. As mentioned, I have patients come in to see me from other chiropractors all the time. And when asked why they are switching care to our clinic, many times they tell me stories that would absolutely blow your mind. One of the more common stories includes x-rays, and then a session where the chiropractor scared them about their health and their future, and then long-term recommendations that, like I say, can include 70 up to 100 visits over the course of a year or so, costing $5,000-$8,000, just crazy stuff. And you might think it sounds silly for someone to agree to something like that, but the truth is, most of the time, a scripted and rehearsed scare session used normal and average x-ray findings to manipulate them and twist them into compliance. And this is not patient-centered, and it's most certainly not evidence-based. A more evidence-based, patient-centered way to approach patient treatment, the approach used here at Creekstone Integrative Medical, is to understand that any new condition, it might take a bit of consistency to get the pain turned around and going in the right direction. Most musculoskeletal conditions just take a little bit of time. Think about exercise, physical therapy, balance training, massage, weight training, things of that nature. All these things take time and a little bit of consistency so that you can reap the fruits of the labor. Now, keeping this in mind, it makes sense to treat an injured patient 2 to 3 times a week for a week or two, maybe 3, maybe even a month. Assuming the patient is doing well, though, after the first couple of weeks, I simply go by the phrase, the better you're feeling, the less I want to see you. All the while, I engage the patient in specific and targeted exercises and movement that can be done at home by the patient on their own, without me involved. And this works because our software tracks our patients, and around 80% of them are fully satisfied with their progress and pain relief at the 30-day mark. In our view, the winner in this scenario is the Creekstone patient. Not only did they get back to normal, but they did so quickly and inexpensively, and without wasting a lot of time coming to our clinic 70 times this year. And it turns out that research backs this up. Spinal and joint manipulation, movement, strengthening, encouragement, optimism, and patient education go a really, really long way towards getting somebody where they want to be. Certainly when you're teaching the patient to manage their condition at home on their own. Education and science are also showing us that you actually can go to the chiropractor too much and too often. And you know this comes from the right place because telling you this information does not benefit me whatsoever, not even a little bit. So to demonstrate why I say this, let me offer you an example. Have you ever known someone that pops their own neck? Well, in the beginning, when they first started doing that, it was kind of difficult to make that pop happen. But after some time of popping their necks repeatedly and mobilizing it more and more, well, it got easier and easier to do. It eventually gets to the point that most of them can simply just kind of turn their heads and it pops. And that is called instability. And it came about because of the continual popping and continual mobilization of joints in their neck. Joints that didn't need all that. Now, instability can come about naturally, too, through injury or degeneration. Broad-based bulged discs are a sign of instability. But it can also absolutely come from too many visits too frequently to a chiropractor that mobilizes the spine over and over and over and over again. Chiropractors need to know clearly when to mobilize and when to stabilize. Sometimes patients have Ehlers-Danlos. They're hypermobile, very flexible people. Lots of those folks don't need more mobilization, do they? There's already a touch of instability there. Chiropractors can actually make that worse. There are also several other reasons for patients to have back pain. A disc injury leads the group of things that can cause this. Discs and then facet joints are right up under that in terms of prevalence, and then pelvic issues. Right in there somewhere is instability. And some research papers even estimate as much as 60% of low back issues can be attributed to spinal instability. Now, assuming this is true, well, patients with low back issues might need to engage in stability protocols about 60% of the time rather than consistent all the time back popping. So research is ongoing with regard to instability, so stay tuned. Trust me, when there's more learned, there'll be more videos. Lastly, let's talk about the style of practice a chiropractor uses. The style of practice a chiropractor follows often will dictate how often they tell you to come back to see them. Chiropractic is not all that well standardized. So there are different styles of chiropractic. Now, for some people, that's a really good thing. That means there's a chiropractor for every kind of person on the planet. I prefer to be a little more standardized than it is. But let's explain a little bit. Evidence-based, patient-centered chiropractors typically focus on pain and getting their patients out of pain quickly and inexpensively. The more vitalistic, philosophy-based chiropractors often believe their patients need to be seen weekly or every other week throughout their lifetimes, regardless of whether they have any pain or any real issue. And the thought is that doing this kind of frequent schedule is going to keep the patient healthy and free of dysfunction. And it's going to fix earaches and asthma and all kinds of maladies. This style of chiropractic includes many visits very frequently over the course of one's lifetime. And I'm going to let patients make up their own minds about how often they want to be seen and which style of chiropractic is right for them. But I will say that I'm a bit of a research nerd, and I have yet to see any research suggesting any kind of immune system boost from spinal manipulative therapy beyond a small and very temporary boost. And who's to say getting hit in the butt with a 2x4 doesn't have the same sort of short-term and small effect? We don't know. The research hadn't been done on that yet. But the last thing I'll cover here is the idea that once you go to a chiropractor, you always have to go, as in forever and ever, amen. And I have no clue where this little myth originated from. But I'm just going to tell you right here, it's just not true. A good chiropractor needs to be getting their patients out of pain as quickly and as efficiently as possible while teaching them at home self-management techniques so that they learn to depend on themselves rather than any one doctor, any one clinic, or any one profession. Once again, that is called being evidence-based and patient-centered. Some doctors, including chiropractors, dentists, pharmacists, physical therapists, medical doctors, and just about anybody else, some of them use tools and words in order to work on patients' minds to convince them that they somehow need their services frequently for a lifetime. And some think that that is weekly for life, monthly, or whatever the provider happens to think. The truth is that in healthcare, treatments should have a beginning and they should have an ending. They should not be ongoing for a lifetime. It's my opinion and my practice style to approach every patient and every condition with a broad-based management approach, meaning that we may use all of the tools we have available so that we can knock out pain quickly and inexpensively. Some of these tools include an accurate diagnosis by a fellowship-trained, board-certified, and very experienced chiropractor. We use up-to-date and current medical services with a nurse practitioner here in our building. We use specific and very targeted exercises, spinal decompression, low-level laser, massage therapy, acupuncture, and more. All of these things are recommended by the American College of Physicians as first-line therapies for treating pain. And all of this is under one roof, working together to get you out of pain right here at Creekstone Integrated Medical. This approach, like I said, is backed by evidence, and it is in the best interest of our patients. Not only that, again, it's convenient because here in Creekstone, all providers are in one building, one office. And if you think we can help you, I encourage you to call us right here at Creekstone Integrated Medical at 806-355-3000, and let's get you on the schedule. If you're watching us on YouTube, subscribe. like, and share. If you're watching us on Facebook, comment, like, and share. Like I said, you have people that you know on your social media list that either need this information now or they're going to need it in the future. Well over 80% of all humans on the globe suffer back pain at some point in their lives. It's the #1 reason globally for disability. So share so they know they can get treated without having to worry about going a million times. Again, I'm Dr. Jeff Williams. Until next week, take care, and we'll see you then.